Dr. Robert Peppercorn, and this is the Yuba Sutter Medical Explorer. As a specialist in skin diseases and allergies, and as host of this program, I will take you on an exploration of the medical communities of Yuba and Sutter counties and bring you behind the scenes of medical care practices right here in our local area. Our program tonight will introduce you to one of the most modern diagnostic tools available in Yuba City and Marysville that allows doctors to painlessly look inside the human body without needles or surgery. Tonight, our Channel 5 Medical Explorer cameras will take us into the radiology department at Rideout Hospital as we explore their CAT scanner. This computerized axial tomography scanner is the most modern unit of its type, and there's no better piece of equipment available in the Twin Cities area. Tonight we'll have the opportunity to meet a medical specialist who can also expertly use the CAT scanner. This is a specialty called radiology. In the pharmacy corner tonight, our neighborhood guest pharmacist will tell us about non-prescription cough medications. Is there an effective and safe way to help your cough by making a simple trip to your drugstore? Well, we'll learn the answer to this question and others about cough medications in the pharmacy corner tonight. Tonight's show will be extremely timely and very informative, and I hope that you'll stay with us for the next half hour. Before getting to our main topics tonight, let's take a look at the latest medical news. Pregnant women with sexually transmitted infections are more likely to have premature deliveries and newborns with serious abnormalities, according to two recently released studies. One study of 500 women conducted at the University of Washington at Seattle found that 19% had bacterial vaginitis, a bacterial infection caused by several kinds of germs, and 9% had another germ called chlamydia. Women with these infections had twice as many premature deliveries as women who didn't, and women with chlamydia infections had almost 3 times as many premature births. Among women with chlamydia infections, 30% had low birth weight babies compared to 15% with no infections. In the second study, 2% of 15,000 pregnant women had active infections with a herpes virus called cytomegalovirus. 1/3 of infants born to cytomegalovirus-infected women were also infected, and 1/3 of these infants later developed hearing loss, mental retardation, and other handicaps within 3 years after birth. These studies were reported in a recent issue of the Journal of the American Medical Association. Next in the medical news is more bad news for those coffee lovers out there. A 5 cups a day coffee habit can increase your risk of heart disease by 2 to 3 times, according to a new study in the New England Journal of Medicine. But the finding, first released about a year ago, has stirred vigorous debate, and several other studies have failed to find the link. More research is needed before making any public recommendations, according to researchers at the Johns Hopkins University School of Medicine in Baltimore. The scientists had hoped to stimulate more research rather than show that one study, no matter what the findings, is going to conclusively prove or disprove this coffee hypothesis. The study of 1,000 men followed for between 19 and 35 years found that those who reported drinking 5 or more cups a day were 2.5 times more likely than non-coffee drinkers to have heart attacks or angina, or to die suddenly of heart disease. My final medical news item may give good news for burn patients. A substance that stimulates burn and wound healing in laboratory animals is now being tested on people across the United States. The substance, human epithelial growth factor, can be produced in the laboratory in mass quantities and is identical to the hormone produced by the body to stimulate cell reproduction and healing. The study is being conducted at a Kentucky university. Early reports showed that the substance cut healing time in half when directly applied to wounds. Unfortunately, it's several years before it could be widely used for patients in the United States. It's time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's neighborhood pharmacists. Joining us tonight in the pharmacy corner is award-winning pharmacist Mr. Bob Church from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you.
I understand that many people come to their pharmacists asking about over-the-counter remedies for coughs, often trying to avoid going to the doctor, of course. When a customer comes into the pharmacy, he or she encounters a tremendous number and variety of available products, which all seem to claim that they can stop coughs and help colds. Bob, why are there so many products?
Well, I think it gets down to dollars, really. People in this country spend $1.6 billion a year on cough and cold preparation. It's an incredible amount of money. And there's a lot of companies out there that are designing products to get a piece of that action. So you have a lot of companies and a lot of products, which, yes, it is very confusing, but I think if you took all of those products and segregated them into little categories, you'd probably come up with 4 or 5 well-defined categories of medication.
Well, let's get into these exact groups of cough remedies.
Okay, the first one would be expectorants, a product called guaifenesin. Okay, it liquefies phlegm.
I was always wondering how you pronounce that.
Yeah.
Guaifenesin.
Guaifenesin, yeah.
I'll ask you to spell that. No, just
don't ask me to do that. Another category would be the cough suppressant dextromethorphan.
Now that's the one people hear about all the time. A brand like Robitussin, dextromethorphan.
Right.
You can even buy little tablets, almost like little candy tablets that have dextromethorphan.
Sure. It suppresses the cough center in the brain just like codeine does, but it's non-narcotic. So that'd be a second category. Third category would be combining the expectorant and the cough suppressant in one product. Then another category would be combination of those with antihistamines and decongestants, or either one of those alone with antihistamines and decongestants. So that's probably, 4 or 5 categories encompasses all of those products.
Well, now that our viewers know that there are these 4 or 5 categories, how do they decide which ones to get?
Okay. If you have a cough that is bothering you, but when you cough, you know that you have a lot of phlegm in your upper respiratory system that you're not able to get out, but you know it's there, simply an expectorant, guaifenesin product like straight Robitussin would be good because it will liquefy the phlegm. You haven't suppressed the cough. You're able to get rid of that phlegm. You cough it up, it's liquefied, and it's gone.
Let me ask you a question. When I was in medical school, we were taught that these expectorants may not really do that much. That they really may not get to the exact place they're supposed to get to and really do much. Is there much evidence? Do you know about that?
There is evidence actually both ways, and you're right, there is a controversy as to how effective those products are. I know from personal use and telling my customers about using Robitussin and following it with a glass of warm water that it does seem to be effective. Now maybe it's the warm water by itself, we don't know.
Right.
But I personally believe there's some value to that product.
How about when they would use some of the other groups?
Okay, the cough suppressant by itself would be when you have just a very harsh, dry, nagging cough that you've got to suppress to get some relief. Then you would use that. If you have a very heavy cough with phlegm that you need to break up and loosen up, you could use the combination of the two, the expectorant and the suppressant. All of the other products then are those products with antihistamines and decongestants for opening up the nose, drying up the nasal passages, getting rid of the allergic responses that you get when you have a cold.
Well, you're getting 4 or 5 medications all in one product.
Yes, and sometimes I'm not sure that's all that great either.
Are there situations when taking these over-the-counter cough remedies could be dangerous?
Yes, if people have certain disease states such as diabetes, heart problems, thyroid problem, hypertension, if a person has asthma, they should be very careful about what cough preparations they use. People who have to be very careful about alcohol in products. Some of these products have a large amount of alcohol. Nyquil is 50 proof. That's 25% alcohol.
They're giving these to kids, too.
Yes, which is also very dangerous.
I really wonder about some other things. Let's say somebody has a cough that goes on day after day after day, and they keep trying these over-the-counter remedies. They try one, the cough goes on, they try another, they try another. Weeks are going on. They could be developing pneumonia, they could be getting tuberculosis, they could have lung cancer. They're all possibilities they could miss. So all the bottles say if your cough persists after a certain number of days, consult your doctor. But a lot of people don't realize that when they use these.
That's right. A lot of people don't read all of the warnings and precautions on those bottles. And I was reading on NyQuil, it says if you're taking high blood pressure medication or antidepressants that contain an MAO inhibitor, don't use this product. And I thought, how many people in this country taking those types of medicines know whether they have an MAO inhibitor?
Right.
And how many would call their doctor?
Right,
well, the answer is very few.
Yeah, unfortunately, that's true. Right, MAO inhibitor being one chemical drug that could be in there. That's
Absolutely.
right. That's right. What are some side effects of cough medications?
Well, I think really with the expectorant and the dextromethorphan product, there virtually are no side effects. But it's when you get into these products that have all of the other things. Pseudoephedrine, as far as the nasal decongestant, can cause nervousness, sleeplessness. It causes behavioral changes in children. The alcohol, as we discussed, is not good for children. So from the standpoint of central nervous system stimulation, they are not good if they're used above and beyond what is recommended.
What do you tell your customers if they ever ask you what they could do for their cough without these over-the-counter cough remedies?
Well, I think probably the best thing they can do is to get a lot of fluid and hydration into their lungs in inhaling steam or cold vapors, utilizing either a vaporizer or a cool mist vaporizer. That is very, very helpful, and it's proven that technique may be as helpful as using the expectorants that we were talking about.
Interesting. When is it time for the person that comes into the pharmacy that's tried these medicines, when's it time for him to consult a doctor?
I think it's important that they should consult a physician if, number one, if they're asthmatic and have a cough. Number two, if they have had a cough for 3 days or more and it's still persisting and these over-the-counter remedies are not working, or if they're coughing up green or yellow sputum, they should definitely see the physician.
I think one more very important key there is if they have fever and the fever is going
Absolutely.
on,
High fever.
they've got to get checked out.
Most
It could
definitely.
mean pneumonia, which can be very serious.
Yes.
Bob, that was very useful information, and I hope our viewers will discuss their concerns and questions about cough medications with their physicians as well as their pharmacists as soon as they get an opportunity to do that.
I hope so, too.
I look forward to you returning to the Pharmacy Corner on a future Medical Explorer program. Thank you.
Thank you.
Now, on with the Medical Explorer. Early in the 1970s, British scientists developed a new X-ray device that has totally revolutionized the field of diagnostic radiology during the past 2 decades. This new X-ray tool is called a CAT scanner, which utilizes computers to improve the quality of X-ray pictures. We, the residents of Yuba and Sutter, are quite fortunate to have the most modern form of CAT scanner available at Rideout Hospital in Marysville. Our community is also lucky to have extremely well-qualified radiologists available who understand the proper use of this fantastic piece of modern medical equipment. Let's leave our Medical Explorer studio now and visit the CAT scanner suite at Rideout Hospital with our guest radiologist, Dr. Robert Wankmuller.